Do you know that the Donabedian Model, a foundational framework for assessing healthcare quality, was developed by physician and researcher Avidus Donabedian? He formulated this seminal framework between the 1960s and 1980s. Donabedian's extensive work in defining and measuring quality in health systems. His model categorizes quality assessment into three interconnected components: structure, process, and outcomes. Yes, and its foundational framework for healthcare quality assessment. Healthcare quality, a concept recognized for its inherent complexity and critical importance, has been profoundly shaped by the pioneering work of Avidus Donabedian. As Donabedian himself observed, quality of care is a remarkably difficult thing to define and measure, yet it is one of the most important things we must try to understand. This sentiment underscores the enduring need for a structured approach to evaluating and enhancing healthcare delivery. Donabedian, a visionary physician and researcher, developed his seminal framework between the 1960s and 1980s, fundamentally transforming how quality is conceptualized and assessed in health services. The Donabedian model stands as a robust conceptual framework, specifically designed for the systematic examination of health services and the rigorous evaluation of healthcare quality. It provides a clear, structured methodology to identify areas of strength and opportunities for improvement within complex healthcare systems. Its continued influence is evident in its status as a foundational framework and the dominant paradigm for quality assessment.
What is the components of Donabedian model?
The first component is structure, the foundational context and resources where care is delivered. Attributes of the service/provider. Example: hospital infrastructure, facility design, equipment availability, staffing levels, staff qualifications, policies, operating hours, payment methods. Then the process, the actual actions and interactions involved in providing care. How care is delivered. Example: accurate diagnosis, adherence to treatment protocols, preventive care, for example, mammograms, immunizations, patient education, communication with patients, hand washing, recording incidents, care coordination, patient flow. Then the outcome, the effects of healthcare on patients and populations. Changes in health status, behavior, or knowledge. Example: reduced mortality, reduced length of stay, reduced hospital-acquired infections, fewer adverse incidents, reduced emergency readmissions, improved patient satisfaction, changes in health status, health-related quality of life, cost-effectiveness. The Donabedian model fundamentally asserts that a sound structure should logically lead to an effective process, which in turn should result in positive outcomes. This relationship is commonly depicted as a linear chain of three interconnected boxes, with unidirectional arrows flowing from structure to process to outcome. The foundational structural aspects of a healthcare system exert a direct influence on the processes of care delivered, and these processes subsequently impact the ultimate health status and experiences of patients. For effective quality improvement, evaluating the Donabedian components is not an either/or decision. Each type of measure, structure, process, and outcome serves a distinct and vital purpose in comprehensively assessing whether an improvement PT has achieved its desired impact.